Good morning, friends. Welcome to our next learning session. And today I am to talk about the effects of smoking on the immune system of our body. You have heard of the term immunity number of times. At the time of corona epidemic, the drug companies have been marketing a number of preparations which included vitamins, vitamin D, zinc, copper, and most other constituents, claiming that it boosts your immunity. But this is not the correct answer. You cannot boost your immunity by this way. So, what is there for immunity? Immunity is the protection of your body. The how your body protects against infections or invading organisms or toxins or other foreign substances. That mechanism is called immunity, and that protection is called immunity. So, in nutshell, immunity is the protection of the body against various types of diseases. The there is a term called innate immunity, and there is another term called adaptive immunity. What is this? Innate immunity means the immunity present at birth, and adaptive immunity means immunity acquired during the lifetime by the person. Now, what is immune system? Immune system is a complex network of cells, tissues, organs, and the substances they make to protect the body. The immune system produces antibodies. Antibodies means those substances which protect you against disease. They are anti. So if a microorganism comes in contact with the body and body has antibodies, this antibody will neutralize this. If there is a toxin which has entered your body, if you have antibody, this will neutralize this toxin. So antibodies are the very important part of the protecting system. Now, when you have heard of this term also before, also at the time of corona, that your immunity becomes low and you can boost your immunity. You can boost your immunity by your healthy diet, regular exercise, and relaxation techniques. The vitamins, they play hardly much role as far as enhancing your immunity is concerned. Then comes the question of what then I want to show you this diagram. This is diagram of immune system. See, it is very close to your screen. What do you see? You see these things. That starting from the throat itself, you have adenoids, which contain lymphoid tissue, and that is responsible for your protection. Then you come to the neck. You have a thymus gland here which has lymphoid tissue, which helps to make protective cells called B cells and called T cells. This thymus produces T cells which make antibodies and protect you. Then you have On the left side of your body, under the ribs, you have this structure. This is called spleen. The spleen has also lymphatic tissue, and it can create antibodies and protective cells like lymphocytes. Then you of course have the tissue inside your bone marrow. In your bones, it is called bone marrow. Bone marrow also produces protective cells. These are called B cells. So whereas thymus produces T cells, the bone marrow produces B cells. Both these cells are protective to the body. Then there are a number of lymphatic glands, lymph glands, which produce different type of antibodies as well as protective cells, lymphocytes and macrophages and plasma cells to protect the body against toxins and against antibody. So, are there some diseases which are more common in smokers? These immune diseases which are more common in the smokers, one very important is the diabetes mellitus. You all know that in diabetes mellitus, your blood sugar becomes beyond control. It is high. But if you are a smoker, your blood sugar controlling becomes difficult. You require larger doses of insulin. So it is best to stop smoking in such cases. Another disease where smoking is very closely related, as it has been now recently shown, that is rheumatoid arthritis. What is this disease? Look at this diagram. This is the diagram. This is the picture of the hand, and if you look at it, this is the back of the hand. You can see nails here. This is the nail portion. This is the nail, and this is the back of the fingers, and here the fingers are joining the hand. Now look at this portion. This is slightly swollen, and it is spindle in shape. This is also swollen and spindle in shape. This joint is also swollen and spindle in shape, and this joint is also inward. So this is the first joint of fingers. This is the second joint of fingers. So this is called proximal interphalangeal joints. So in rheumatoid arthritis, it is this joint, proximal interphalangeal joint, which is inward. What else is seen in this condition? There is marked morning stiffness. When the person gets up in the morning, the hands are stiff. Patient is unable to carry out any significant movements without pain. But slowly, as the movements of the hand start, the stiffness goes on becoming less, and after about 40 minutes to 50 minutes, the hands become normal. This disease is rheumatoid arthritis, and it has been recently shown that smoking causes rheumatoid arthritis, and the disease becomes very severe in smokers. You know, there are many other diseases which occur, like collagen diseases, like SLE, like systemic sclerosis, and there are many diseases, but it does not serve your purpose by knowing the names of the diseases. But what you should know is that smoking is certainly bad for many diseases. What are the environmental triggers? Smoking is one of the environmental triggers. It produces changes in the DNA of the cells, and therefore changes their behavior and causes damage. As I said, can smoking affect your immune system? Yes, we have already seen it. Can vitamin D reverse autoimmune disease? To some extent, yes, but not significant degree. Can autoimmune disease be cured? No, it cannot be cured. Why do some smokers live long? This is because of their genetic structure. Their DNA is made in such a way that they can tolerate the ill effects of smoking for a long time, and that is why, despite smoking, which is proved harmful thing, they live long. Uh, what is ashwagandha? Is it good for autoimmune disease? Ashwagandha increases your immunity, and when you have immune disease, your immune system is already overactive. It is causing damage to your body, and ashwagandha further increases your activate your immune system, and therefore it will cause further damage. So it is not good for you at this time. Are there some foods which can calm your immune system? Yes, green leafy vegetables can calm your immune system. The other things are turmeric, broccoli, cauliflower, and certain berries. So the important point remains to understand is that smoking is bad for your health. Smoking can cause number of diseases, can make them severe. For example, you know it already that coronary heart disease or heart disease or heart attack is more severe in smokers, and it is one of the causes of heart attacks. So smoking is bad for your respiratory system, that is for your breathing. It is bad for your heart and circulation. It is bad for your brain. It is bad for your intestinal tract, that is the food pipe and the regions. It is bad for your kidney and bladder and the other urinary functions. It is bad for your sexual functions, and there is no end to the harmful effects of smoking. The then why do you smoke? Because smoking releases two hormones in your brain. One is adrenaline, the other is dopamine, and these hormones give you the happiness, and you get a sense of euphoria. Therefore, for this small benefit, you should not endanger your life. So friends, continue your sport by liking, by commenting, and by subscribing my channel, and we will meet next time with another interesting topic. Thank you very much.